So hi everybody. So we are going to show you how to do a first time surgery in Maple Hospital. So first you're going to press surgeon and then we should teleport you to the surgery area. And to claim a patient, you're going to you could either use that and it will ask you to be Charlotte's surgeon, and then or you can go to the pre-op and get her and go whoever you would like. So first it will ask you to scrub in for surgery. That means to wash you. So it's like you just wash in one of these and there's a surgery area. And next you should get a blue settle towel from the operating room that you're going to be surgerying, that you're going to do the surgery. Next he will just ask you to put it away and get a surgery gown, which is right over here next to the exit, and to get a mask and to get a gloves. And then you have to get a clean sheet from the closet and put it on the surgery bed. And then you should wait for a patient to be brought and say hello to David. So once you nurse the surgical nurse, and you have to wait for David V to attach, and then you have to turn on the surgery lights and wait for David to put the oxygen mask on the patient. And then you have to introduce yourself by pressing that button, and then you have to get a sedative from the closet. You can search it up. And then you just put it in the patient's IV. Just press the clicky button and then you shall go in. Okay, now you're going to need a saline flush from the closet, and then you have to put it in the patient's IV again. And then you just need to wait for the patient to fall asleep. And you have to wait for David to illuminate the patient. Then you have to get the ball and put it on the surgery desk and get some like the screen stuff. And then you have to get sponge foreps from the closet. After you got it, you're going to just press use on the ball. Okay. After you got it, you're going to soak it in the beta line. And then use it to like sanitize the patient's skin. And then wait for the surgeon nurse to make an incision on the skin. And then you just like press. And then with the coldering pen, you're gonna open. And then you're just gonna close the line through blood spots, not bloodline. Okay. So after that, you're going to do that again to open the muscles and do it again to stop bleeding. After that, you're going to just put the clamp vessel and get the tissue and cut the tissue around the tumor. And then you just like clamp again the vessels and then cut the tissue again and then do the tumor again and then just check for bleeding and just hold the line, yes, and then you just get the needle driver and salute the muscle and subdue the fat layer, and then just subdue the skin layer. And then the surgical nurse will take the patient to the post-op, which is right next to the ICU. As you can see, it's right there. And then it asks you to throw away your items and get your spectacle man and put it through the tube system. You could find it in the pharmacy, and you move the capsules if needed and put it in. And then you just go back to the surgeon room and log on to the computer in the surgery, and then and then you get 47 XP, but if you do an extra good job, you can get more. And then just go. And then that's all. Bye!